multiple sclerosis, attention deficit disorder, degenerative diseases, diabetes, fatigue, cardiovascular diseases, fibromyalgia, impotence, depression, lack of energy, overweight, rheumatism, short-term memory loss. Is there any hope?
My name is Dennis Harper. I'm a physician and I've been practicing medicine for approximately 9 years. During this period of time, I treated my patients with the drugs that I was taught to use and found that many times my patients were coming back because they were having either side effects with the drugs or because they were not getting the results that I anticipated that they would. Consequently, because of this, I started using alternative methods to treat my patients. Now, in this particular area, there's a whole new class of nutrients called phytonutrients. Within this class of phytonutrients, there is also a specialized class called bioflavonoids. Paranthocyanidins were originally classified as a bioflavonoid, and because of their uniqueness were then spun off and became a separate class of phytonutrients. The paranthocyanidins are an extremely powerful antioxidant. They are approximately 50 times more powerful than vitamin E. They're 20 times more powerful than vitamin C. They stay in the body for approximately 72 hours, giving sustained antioxidant effects. We have seen with the use of the paranthocyanidins changes in live blood cell analysis using dark field microscopy, and in as little as 20 to 40 minutes we've seen a change where before the cells would be stacked on top of each other, something called a rouleau stacking, and 20 to 40 minutes after using the phytonutrients, the paranthocyanidins, and some enzymes, we saw complete dissolution where they were then completely separate.
This is a live blood cell screen using the dark field microscope. The portion that we are looking at is prior to taking the oligomeric proanthocyanidins, or more commonly known as OPCs. We see here small white blood cells trapped in what is known as erythrocyte aggregation, or more commonly known as blood sludge. The primary cause of this condition is high fat and protein in the blood. This condition can lead to poor circulation and cardiovascular disease. This is a uric acid crystal resulting from high concentration of uric acid found in the blood. Uric acid crystals can cause joint pain and inflammation. This can also lead to the onset of arthritis and other degenerative diseases of the bone and joints. Uric acid crystals are also the leading cause of gout, a very painful joint condition. This is a cholesterol crystal identified by lack of color. The principal cause of this condition is poor assimilation of fats and proteins, which in turn is caused by the body's inability to digest the fats and proteins. This can be a leading factor in plaque accumulation in the cardiovascular system, resulting in poor circulation and the potential for stroke and heart attack. The small black lines found here are liver spicules, or fibers which form in response to liver stress and congestion. This can be caused by toxins such as antibiotics, drugs, alcohol, tobacco, and environmental pollution. This condition can lead to autoimmune-associated diseases such as fibromyalgia, multiple sclerosis, and chronic fatigue. This is hemolysis, or dying red blood cells, often due to poor nutrients and poor digestion of food. This also is due to low levels of antioxidants in the bloodstream, resulting in fatigue and low levels of energy. Here you can see yeast or fungus. This is caused by undigested food particles, especially in foods that are high in sugar or white flour. We can trace infections of all sorts to this condition. This is a classic poikilocytosis, or more commonly known as free radical damage. The leading causes of this condition are environmental toxins in the food, water, and air, such as pesticides, food additives, radiation, chemotherapy, preservatives, drugs, chemical fumes, and exhaust from cars, to name just a few things contributing to the low levels of antioxidants in the bloodstream and higher free radical damage, resulting in the acceleration of the aging process. This condition can lead to accelerated aging and early onset of degenerative diseases. Genetic damage and mutation to the DNA is one of the major concerns with this condition. This is a live blood cell sample taken after taking the oligomeric proanthocyanidins, or OPCs. Notice now that instead of the red blood cells being stuck and stacked together, separation is almost completed. Many now are round and free-flowing. In this condition, they now have the ability to be oxygenated and more mobile, thus enhancing greatly the circulation to all parts of the body, such as the brain, vital organs, and providing more oxygen and nutrients for the muscle tissue, which is especially important for athletes or anyone working out or exercising. Notice the cell's ability to separate in just a few minutes. The condition continues to improve with additional time and especially with the continued use of oligomeric proanthocyanidins. Amazingly, the white blood cells have the ability to double or triple in size once the undigested protein in the cell receptors have been resolved, thus allowing the white blood cells to function properly. The white blood cells here is at work cleansing the blood. You can see it resolving a fibrostolic parasitic colony. This is a cholesterol crystal being dissolved and will now be small enough to be filtered by the kidneys and excreted from the body, whereas before they were too large for filtration, thus greatly reducing the potential of plaque accumulation and advanced cardiovascular disease. Again, notice the free-flowing red blood cells. Utilizing the dark field microscope, we can now scientifically show the dramatic increase in the nutritional health of the blood and its ability to function at a much better level within just a few minutes after taking the oligomeric proanthocyanidins. You can see how freely the blood cells can flow with the increased oxygen and nutrients. Especially notice the absence of yeast, liver spicules, hemolysis, or dying red blood cells. We have reduction in bacteria, cholesterol crystals, blood sludge, and plaque helping the body reverse arteriosclerosis. Gone is almost all evidence of free radical damage, thus strengthening the cardiovascular system and improving blood vessel health and circulation. Thanks to these new exciting phytochemical supplements such as the family of oligomeric proanthocyanidins, we can now visually see how these are dramatically changing the way we can enhance the nutritional health of the blood and therefore our overall health, thus helping us to slow, stop, or reverse the aging process. We find dramatic improvement in the condition of the DNA, the building blocks of the entire body, changes that can take place overnight or with continued use over a prolonged period of time depending upon the individual. We now possess the ability to actually grow younger with proper nutritional supplementation and especially using the oligomeric proanthocyanidins. So we can tell in a very short period of time that the phytonutrients, including the proanthocyanidins, are extremely important to a person's well-being. This particular class of bioflavonoids, the proanthocyanidins, are very bioavailable. That's one of the unique parts of the proanthocyanidins. They tend to be almost 85 to 95% absorbed just by taking them orally, whereas with the other bioflavonoids, they're extremely difficult to absorb. Sometimes you only have 5 to 10% bioavailability. Would like to explain now as to the reason why these proanthocyanidins actually work this well. They are an extremely powerful antioxidant. They're 50 times more powerful than vitamin E. They're 20 times more powerful than vitamin C. And you might say, well, what is an antioxidant? Well, an antioxidant is something that fights against something called a free radical. Now, you say, what is a free radical? A free radical is an atom that has an unpaired outer electron shell. Now, atoms generally will tend to have at least paired electrons that will circle around their outer shell. When one of them is missing, it becomes unstable, and consequently it actually kind of reaches out and says, I'm going to grab yours. And as it grabs somebody else's electron, it then becomes a paired electron, but the other one then, of course, becomes unpaired. And so consequently, one free radical starts something called a free radical cascade, which means that one free radical taking from another atom can create millions of free radicals. Fortunately, our bodies are designed to help with the free radical cascade, and that's where the antioxidants are becoming so important. Where do we get these free radicals? Well, they come from three places. They come from inside ourselves, from biochemical reactions, they come from the environment, and they also come from free radical cascades, which I just mentioned. Now, when I talk about the environment, I'd like for you to understand a little bit about the environment. We're talking about pesticides, we're talking about herbicides, we're talking about automobile emissions, we're talking about sunlight, we're talking about a whole host of things that are out there that are trying to destroy us. There are other things other than what's being dumped into the environment. For example, when we walk out into the sunlight, what do we see? We have ultraviolet radiation that comes down and beats upon our skin and consequently causes free radicals to
damage the very skin that we're wearing. And by so doing it, you've heard of skin cancer. Certainly those are caused by free radicals and by the ultraviolet radiation damage. As it damages those tissues, you start having burning. All of you have experienced sunburns. That's from the free radicals. It's very similar to any other type of a fire. The hotter the heat or the more free radicals that are being released, the more damage you're going to have. First degree, second degree, third degree burns. All happen with free radical damage. The way free radicals damage our cells is each cell has its own little individual markers on the outside, which genetically allow the body to determine that it's part of itself. So it has these little proteins that kind of stick out on the cell membrane. The membrane itself is also composed of a lipid bilayer, which kind of looks like this, where it likes the water on the outside and it likes the fat on the inside. And then inside the cell you have a round or a nucleus that has a nuclear membrane as well as DNA particles on the inside of the nucleus. The free radicals can damage any one or all of these parts of this particular cell. It can take the proteins off the surface of the membrane to where the body no longer recognizes a cell. It can destroy the lipid bilayer to where it actually glues it shut, to where nothing can then penetrate through the membrane and get into the cell to nourish the cell. It can open holes in the membrane and allow the cytoplasm inside the cells to leak out, as well as to have bacteria and viruses leak in, causing cellular death. Or it can go in and it can rupture the nuclear membrane, create havoc with the DNA genetic particles there, consequently creating mutations. And by so damaging these cells, then we see all kinds of things taking place in our bodies. For example, arthritis. Down here, for example, in your knee, we have synovial membranes there that have synovial fluid inside of them. If those membranes start to becoming injured, they will start leaking synovial fluid, which causes compression on that joint. Consequently, you start having more inflammation. That inflammation, in turn, brings in more cellular debris, trying to fix the damage and creates more inflammation. We also see the problems associated with the eye. I talked about the sunlight. If you're looking at our eyes, the intraocular space of our eyes is filled with fluid. That particular fluid is loaded with antioxidants. The reason why it's loaded with antioxidants is because it's being barraged with ultraviolet radiation all the time. So consequently, with the use of the antioxidants, it prevents our vision from deteriorating. Consequently, using the paranthocyanidins or the antioxidants will, as far as I'm concerned, help prolong any visual disturbance or keep us from having any visual disturbances for a much longer period of time than we would normally have had. We've also seen problems associated with cancer. All of us know what cancer is. You know somebody that has cancer. I know somebody that has cancer. If you don't, you will, because the cancer rates have gone up very, very sharply from 1 in 10 up to 1 in 3 now, and very shortly, who knows, in a few more years, you're going to be looking at 1 in 2. And this all has a very great deal to do with the free radicals and the free radical damage that takes place and the lack of antioxidants, not only in our food, but in our environment as well. Our hearts are also damaged by free radicals. How are they damaged? Well, we have blood that goes through our hearts, and that blood carries oxygen, as well as other things that produce free radicals. Those free radicals, in turn, damage the cells that are on the inside of the arterial wall, creating something called plaque. That plaque is actually like a little Band-Aid that tries to cover up the damage, and it attracts other cells, and pretty soon you have a little clumping that takes place. And the more free radical damage that takes place, the thicker that clump becomes, and it starts bringing cholesterol in there, which is also a residue of some of the cells that are damaged. Now, cholesterol is both good and bad. You've heard of HDL cholesterol, you've heard of LDL cholesterol. HDL cholesterol is one of our antioxidant systems. When HDL levels are oxidized, or our HDL cholesterol is oxidized, it actually turns into an LDL, which becomes bad cholesterol. So once again, we see oxidating materials, the free radicals, creating havoc inside of our body.